Europe is officially back in the danger zone as Spain forces masks back on. But the real nightmare isn't the flu. It's the explosion of deadly bird flu detections that have experts terrified of a new pandemic. But first, let's clear up the confusion about what is happening in Europe today. The surge in respiratory illnesses forcing Spain to implement mask mandates and the UK to issue health advisories is not caused by bird flu. It is being driven by a tripledemic of three familiar enemies: COVID-19, RSV, and an unusually aggressive strain of the seasonal flu known as H3N2. This H3N2 strain hit earlier than expected and is putting immense pressure in hospitals, which is why officials are asking people to wear masks in crowded spaces and healthcare centers. While this is a severe winter health crisis, it is effectively a bad flu season, not the start of a new pandemic. However, there is a separate, darker signal flashing on the global radar that is unrelated to the European flu outbreak, but far more concerning for virologists. A resident in Washington state recently died after contracting a rare strain of avian influenza called H5N5. This is significant because it marks the first known human case of this specific strain. While the patient had direct contact with infected backyard poultry and did not spread it to others, it serves as a warning shot. It proves that these avian viruses can jump the species barrier, even if they cannot yet spread from human to human. If we were to face a hypothetical bird flu pandemic, the dynamics would be terrifyingly different from COVID-19 due to one brutal statistic: the mortality rate. At its absolute worst, COVID-19 had a case fatality rate of around 2 to 3%. In contrast, historical data of human cases of highly pathogenic bird flu shows a mortality rate closer to 50%. If a virus with that lethality mutated to spread as easily as COVID, it wouldn't just strain hospitals. It could collapse essential services like power, food logistics, and transportation, because too many essential workers would be critically ill or dying. Economists estimate that such an event could cost the global economy over $3 trillion in a single year, triggering a depression worse than the 1930s. Despite these scary numbers, there is a massive firewall protecting us. Right now, bird flu is terrible at infecting humans because it binds to receptors deep in the lungs, whereas human flu viruses bind to receptors in the nose and throat, making them easy to sneeze out and spread. For bird flu to become a pandemic, it would need to undergo a complex series of genetic mutations to unlock those upper airway receptors. Furthermore, unlike 2019, when we had no weapons against COVID, we already have stockpiled vaccines and effective antivirals for H5 strains. We aren't starting from scratch. So, while the world watches the virus closely, your best defense today is simple: follow the standard flu precautions for the current outbreak and ignore the doomsday panic.